Welcome to the deep dive. Today we're getting into something, well, a bit unexpected maybe. Systemic aspergillosis in animals.
hmm
Yeah, this isn't just your garden variety mold issue. We're looking at a potentially really serious fungal infection, especially for dogs and cats.
Exactly. It's a deep-seated problem, not superficial. And our goal today really is to unpack what this thing is.
Right.
Who gets it most often? What does it actually look like? And what makes it so challenging to diagnose and treat?
Mm.
We've dug into the research to hopefully give you a clear overview.
Without getting too technical.
Try not to, yeah.
And when we say research, we're talking about various studies, findings, all focused on this specific fungal condition. Okay, so basics first. Aspergillus the mold. It's everywhere, right?
Oh, absolutely. Ubiquitous,
Yeah.
dust, soil, hay, decaying plants, you name it.
But the systemic form we're discussing is different from, say, a simple nasal infection.
That's a really key point. There was one report, I think, mentioning a possible link where a dog had nasal aspergillosis that maybe led to a bone infection later. But generally, when we talk about disseminated disease,
Hmm.
the systemic kind, it's usually a whole different ballgame. It tends to be caused by specific Aspergillus species, mainly A. tertius or A. deflectus.
And how does it get systemic? How does it spread?
Well, the thinking is it usually gets in through the respiratory tract. So breathing in spores or possibly the gastrointestinal tract, like ingesting them.
Okay.
And from there, it manages to invade the bloodstream and just travels. Think of it like seeds catching a ride on a river throughout the body.
And where do those seeds tend to land? Which parts of the body are most affected?
The research highlights a few common spots. The intervertebral discs, the spinal cushions,
Right.
the bones themselves, lymph nodes, especially in the chest, the lungs, definitely, and also the renal pelvis part of the kidney.
So quite a range. Can it stay localized anywhere else?
Sometimes, yes, it might just affect the respiratory system,
Yeah.
and much more rarely, it can pop up in the cornea of the eye or even the ear canal.
Interesting. Okay, that sets the stage. Now, who's most likely to get the systemic version? Which animals?
The data shows it's definitely more common in dogs than in cats.
Okay, dogs.
And within the dog population, there's a really strong predisposition in German Shepherds. They're significantly overrepresented.
Wow. Any others?
Rhodesian Ridgebacks seem to show up a bit more often too, but German Shepherds are the main one. It can happen in lots of breeds, though. The average age is usually around 3 years, but the range is maybe 2 to 8 years old.
And anything else? Male, female.
Ah, yes, that's quite striking. Female dogs are about 3 times more likely to be diagnosed than males.
3 times? That's huge.
It is a really significant difference.
Okay, so German Shepherds, females especially. What about cats? You said it's less common, but...
It is less common, yeah. There seems to be a slightly higher risk noted in Persian cats.
Persians. Okay.
And when cats do get the disseminated form, it tends to hit the lungs and or the GI tract most often.
Got it. So we know the who. Let's move on to the whats. What signs, what symptoms should make someone even think about this? What are the clues?
In dogs, it's tricky because the start can be really variable. Sometimes it hits fast and hard. Other times it's slow, creeps up over months.
So they might already be quite sick when you see them.
Often, yes. They're frequently very ill by the time they get to the vet. And the signs, well, they depend entirely on which organs are involved.
Makes sense.
So, for instance, if the bones are infected, what we call fungal osteomyelitis,
Right, bone infection.
yeah, you might see lameness, obviously, swelling over the affected bone, maybe even draining tracts, little openings where fluid or pus leaks out.
Whew, that sounds nasty. What if it hits the spine, those discs you mentioned?
If it's fungal discospondylitis infection of the discs and vertebrae, then you're looking at neurological signs. Things like weakness in the back legs, what we call paraparesis, or even full paralysis. Spinal pain is common too.
And if it gets into the brain or nervous system more generally?
Then you can see a whole range of things. Balance problems, vestibular signs, seizures, just being generally weak or mentally dull, difficulty coordinating movements, vision problems, even walking in circles.
It really sounds like it can mimic a lot of other conditions.
That's one of the biggest challenges, absolutely. It can look like so many other things.
You mentioned kidneys earlier as a target site. What signs point to kidney involvement?
Increased thirst and urination are big ones. You might also see blood in the urine.
Okay.
And then there are respiratory signs, coughing, sometimes coughing up blood, difficulty breathing. Less commonly, you might see things like pyometra, a uterine infection, or heart issues.
Heart issues, like what?
Pericarditis, which is inflammation around the heart, maybe fluid buildup in the abdomen because the heart's not working well, irregular heartbeats,
Wow.
also GI signs like a swollen belly or loss of appetite, eye inflammation, bleeding inside the eye,
Uh-huh.
and then just the general stuff, fever, weight loss, lethargy, vomiting, enlarged lymph nodes. It's a long list.
It really is. A very long and frankly pretty worrying list for dogs. Is it similar in cats or are the signs different?
In cats, the signs often seem to be more nonspecific. Things like just being tired, lethargic, depressed, maybe vomiting or having diarrhea. More vague, generally.
But any specific signs in cats?
There is one notable eye sign, sometimes seen in cats, exophthalmos. That's where the eyeballs bulge out abnormally.
Okay, bulging eyeballs, got it. So we have the what, the who, the how it looks. Let's dig into the why a bit more. What are the actual culprits, and are there risk factors beyond breed?
Well, the direct cause, as we touched on, is infection by Aspergillus fungi. A. terris and A. deflectus are the usual suspects for the systemic form.
But others too.
Yes, others like A. fumigatus, A. niger, A. flavipes, A. alabamensis have also been found. And more recently, A. helix has been implicated in cats, dogs, even people.
So a whole family of fungi. We know German shepherds are at higher risk, and you mentioned immunocompromised animals. What else? Does where they live matter?
It might. There seems to be a geographic element. Certain regions report more cases. In the U.S., think California, Louisiana, Michigan, Georgia, Florida, Virginia.
Okay.
And internationally, places like Western Australia, Barcelona, Milan have also noted higher incidences. It suggests environmental factors could play a part.
And for cats, any other associated risks?
Yes, in cats, it's often seen alongside other diseases. Things like FIP, feline infectious peritonitis, FeLV, feline leukemia virus, FIV, feline immunodeficiency virus.
So underlying conditions.
Exactly. Or conditions like diabetes, or if they're on medications that suppress the immune system, like steroids.
Right. This sounds incredibly complex to diagnose then, with all these potential signs and risk factors. If a vet suspects it, what are the initial diagnostic steps? What else could it be?
Yeah, the diagnostic path. It starts with thinking about differential diagnoses, all the other things it could be. And that list is long. Lameness and spine pain. Could be bacterial infection, a tumor, an injury. Kidney signs. Could be a bacterial kidney infection, lung signs, bacterial pneumonia, neuro signs. Tons of possibilities. Eye issues, same deal.
So you have to rule a lot out. What about standard lab work? Blood tests, urine tests?
Absolutely. That's usually the first step. CBC, chemistry panel, urinalysis. But, and this is important, these are often non-specific for aspergillosis.
Meaning they don't scream fungus.
Exactly. In dogs, you might see high white blood cell counts suggesting inflammation, maybe anemia specifically, non-regenerative anemia in about a third of cases, meaning the body isn't making new red cells properly.
Okay.
Cats might also have anemia, sometimes low white cells. The chemistry might show high globulins. Those immune proteins may be changes indicating liver or kidney stress, electrolyte shifts. The urinalysis might show dilute urine, blood, white cells.
Anything more specific in the urine?
Sometimes, yes. You might actually see the fungal hyphae, the thread-like bits in the urine sediment. Fun fact, sometimes letting the urine sample sit for a day or two at room temp can actually make the hyphae easier to see.
Huh. Okay, so those tests give clues. But how do you get a definitive diagnosis?
Definitive diagnosis really hinges on identifying the fungus itself. Usually that means getting a sample from somewhere that should be sterile urine, bone, spinal fluid, blood, lymph node, tissue biopsy.
And growing it in the lab.
Exactly. Fungal culture, urine culture works in maybe half the dog cases, but growing it takes time, usually 5 to 7 days on special media.
Are there other tests? Antibody tests?
Antibody tests exist, but the reliability for systemic disease is questionable. There's also a test called the galactomannan antigen ELISA. It looks for a piece of the Aspergillus cell wall.
Is that useful?
One small study found it pretty good in urine or blood. Sensitivity and specificity were decent, but it's less reliable for lung or eye infections. And you can get false positives, say, if the dog had certain IV fluids or has other fungal infections.
Okay. And in cats, you'd also test for those underlying viruses like FeLV and FIV.
Definitely. That's crucial context in cats.
What about seeing the damage? Can imaging like X-rays or ultrasound help?
Oh, absolutely. Imaging is vital to see where the infection is and how bad it is. Spinal X-rays, if there's discus spondylitis, might show characteristic damage to the vertebrae, maybe bony bridging.
And if it's in other bones?
With osteomyelitis, you might see bone destruction, but also new bone formation, sort of reaction around the infection site.
Lungs.
Lung changes on X-ray are a bit less common. but could show weird patterns, enlarged lymph nodes in the chest, fluid, even holes or cavities in chronic cases, maybe lesions on the sternum.
And ultrasound, what's that good for?
Ultrasound is great for looking inside the abdomen. Kidneys are a key target. You might see a dilated renal pelvis, maybe debris inside, the kidney structure looking distorted or patchy, enlarged kidneys, maybe even masses.
What about other organs?
The spleen is another one. A classic, though not always present, sign is dark, lacy patterned areas that don't have blood flow, suggesting tissue death. Or you might see nodules or a mottled look. Ultrasound can also pick up enlarged lymph nodes, liver changes, fluid in the belly, sometimes even blood clots.
And MRI.
MRI can be really helpful, especially for seeing brain lesions if there are neurosigns, or for spotting subtle spine damage in discus spondylitis cases that X-rays might miss.
It really sounds like a puzzle combining the signs, the lab work, the images. What about actually looking at the tissue itself? Biopsies.
Yes, histopathology, looking at tissue samples under the microscope, is often the gold standard for confirmation.
What do you see?
You can usually see the fungal hyphae, those threads, especially with special stains. You'll often find these little pockets of inflammation called granulomas in various organs. Kidneys, spleen, lymph nodes, heart, pancreas, liver.
The body trying to wall it off?
Essentially, yes. Little fortresses. You can find them in the lungs, eyes, thyroid, uterus, brain, prostate too. And inside these granulomas, you see the fungus, septate hyphae, meaning they have cross walls branching, maybe with these little spores called aluriospores budding off.
Okay, that paints a very clear, if grim, picture of what's happening inside. So the big question, what can be done? What are the treatment options?
Okay, treatment. In dogs, we need to be realistic up front. A complete cure is unfortunately rare. For dogs that are really sick, the prognosis is often poor.
So the goal is more management.
Often, yes. The main aim is usually to stop the disease from progressing. If the kidneys are badly affected, supportive care like IV fluids is critical.
Any surgical options?
In very specific cases, yes. If the infection is truly localized just to one lung lobe, for instance, and hasn't spread, removing that lobe surgically, followed by antifungal drugs, has worked for some dogs.
What about cats with systemic disease?
Yeah, for cats, there's really limited information on treating the disseminated form. It's presumed to be very difficult to treat successfully.
So focusing on dogs then, what medications are used?
The combination often considered the treatment of choice is an oral antifungal called itraconazole, given daily, plus amphotericin B, which is usually given intravenously several times over a period.
Does itraconazole ever work on its own?
It can, yes. Some dogs have achieved long-term remission with just itraconazole. There are also newer drugs in the same family, the azoles, things like voriconazole, posaconazole, ravuconazole.
Are they effective?
They show activity against Aspergillus, and there are reports of dogs going into remission for many months on these. One thing to note is that Aspergillus is usually resistant to fluconazole, another common antifungal.
Any other drug options?
Tobinafine is another antifungal that can be used, sometimes combined with an azole, especially if there's resistance, similar to how it's used in humans. There are also drugs called beta-glucan synthase inhibitors. They work well in people, but we don't have much data on them in dogs yet. And potentially combining flucytosine with amphotericin B, though again, not many published animal cases.
It sounds like there are options, but maybe not guaranteed fixes. Are there side effects or warnings with these drugs?
Oh, definitely. Amphotericin B, the traditional form, can be tough on the kidneys. So you have to be very careful, especially if there's already kidney disease.
Is there a way around that?
Yes, thankfully. There are lipid formulations of amphotericin B now, which are much less nephrotoxic, much kinder to the kidneys.
Okay. What about the oral drugs, like itraconazole?
They can cause things like nausea, maybe intermittent appetite loss, elevated liver enzymes sometimes. Combining flucytosine and amphotericin B has been linked to skin reactions in dogs.
Any critical drug interactions?
Yes, very important. Avoid giving drugs like midazolam or cisapride concurrently with atirazole antifungals. Serious, even fatal reactions have occurred in humans. And higher doses of itraconazole increase the risk of liver issues and skin ulcers. If side effects happen with itraconazole, you usually stop the drug, but might be able to restart at a lower dose later.
So careful monitoring is key. What does follow-up care look like?
For systemic cases, yeah, regular follow-up is essential. Repeat X-rays, maybe every month or two, to track progress. Monitoring kidney function regularly. Repeating urine cultures to see if the fungus is clearing.
And the prognosis overall?
It remains guarded to poor, especially for German Shepherds with widespread disease. The monitoring helps decide if treatment is having any effect and guides decisions about quality of life.
Right. So pulling this all together, systemic aspergillosis, it's this really complex, often very serious fungal invader. Hits dogs more than cats, with a clear bias towards certain breeds like German Shepherds, and often those with weaker immune systems.
Exactly. Less common in cats, but can happen, often linked to other health problems.
And figuring it out is tough. It needs a combination of looking at the signs, lab tests, hunting for the fungus, and imaging to see the extent of the spread.
That's right. Diagnosis is definitely a challenge.
And treatment. Well, options exist, but a cure, especially once it's disseminated, is often elusive.
Unfortunately, yes. Management and trying to halt progression is often the realistic goal. It really underscores that connection, doesn't it? Between the environment, the individual animal's factors, breed, immune status, and how something common like fungal spores can become a major threat under the right or maybe wrong circumstances.
That's a really powerful way to put it. The intersection of environment and individual vulnerability. So, for you listening, if any of this resonated, perhaps reminded you of a past experience with a pet, or just sparked more questions about animal health and these kinds of infections, we definitely encourage you to check out reliable veterinary resources or talk to your vet for more in-depth information.
Absolutely.
Thanks for joining us for this deep dive.